Hi, my name is Lucy Cassidy, Practice Liaison Officer for Knox LMC. As the LMC, we're working closely with colleagues within the LPC and CCG Medicines Management Team to summarise the latest updates and information with regards to prescribing, medication and pharmacy changes as a result of COVID-19. Within Liaison Team over the last week, we've seen a huge increase in the amount of practices that are contacting us and informing us that patients are contacting the practice asking for medication early and asking to overorder so that they can stockpile. All GP practices were contacted by the Chief Pharmaceutical Officer for NHS England and Improvement on the 19th of March, who informed them that currently there's no national shortages in medication as a result of COVID-19. However, we know that locally, due to increased patient demand, there may be temporary shortages in certain medications. So as an LMC, we'd always encourage in the first instance liaise with your pharmacy colleagues within your practice or within your PCN, because they'll be able to provide you with an update on stock levels and availability within the local area. We also know that practices and pharmacies are seeing an increase in demand for just-in-case medications such as antibiotics and rescue packs for patients with COPD and asthma in cases of suspected COVID-19. Interim guidance, in line with national guidance, explains that there's no indication to change prescribing strategies around rescue packs. The CCG Medicines Management Team have got some really great guidance on GP TeamNet that's available, which explains this in more detail. And they've also provided patient comms, which you can use on your practice websites and signpost patients to, which explains why GPs can't overorder and overprescribe for patients. So in line with national guidance, practices are obviously advised not to issue repeat prescriptions sooner than they're due and not to issue more than usual so as not to disrupt the supply chain. So what can practices do? So keep in regular contact with pharmacy colleagues, continue to promote the use of the electronic prescription service, and where appropriate, consider moving patients to electronic repeat dispensing, because this allows GPs to authorise up to 12 months of repeat prescriptions for patients with chronic conditions who are on stable medication with just one digital signature. I hope you found this video helpful. Please continue to phone, email, text. We're always here if you need us, and thank you for all that you're doing at the moment as a result of the coronavirus to keep our patients safe.